Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The Governor of Lagos State, Babajide Sanwo-Olu, asks Lagos residents to get vaccinated and boosted. Governor of Taraba State gets booster jab, sets up more vaccination sites. And Israel says fourth jab confers a five-fold increase in antibodies fighting COVID-19. Thank you for joining us. A new coronavirus variant called IHU has emerged in France amid the rapid surge of the Omicron cases across the world. The B16402 variant was discovered at the Institute IHU Mediterranean Infection. Researchers believe that it contains 46 mutations. This has more mutations than the Omicron variants of COVID-19. However, the researchers note that it is too early to speculate on how this variant behaves as far as infection and protection from vaccines is concerned. Meanwhile, 6 deaths were recorded as Nigeria Center for Disease Control also announced 670 new confirmed cases on the 3rd of January 2022. Here's more of the pandemic update in the country.
670 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states and the FCT, indicating an increase from figures reported earlier. Lagos accounted for the highest number of cases with 277 infections. Kaduna had 199, FCT 120, Kwara 20, Abia 14, while Rivers registered 11 cases. Gombe and Katsina registered 9 cases, while other states, including Bauchi, Edo, Cross River State, logged a single-digit infection. The total confirmed cases in Nigeria now stands at 244,120. The report also includes a backlog of confirmed cases and discharges from the FCT, Kaduna and Abia states, as well as 0 cases from Plateau and Sokoto states. 828 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 216,180. There were 6 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,045. Currently, there are over 24,000 active cases in Nigeria, while more than 3.8 million samples have been tested so far. With over 14,000 positive samples, Lagos State accounts for the highest number of cases in admission, followed by the FCT and Delta State. More than 10.6 million eligible Nigerians targeted for COVID-19 vaccinations have received their first dose, while over 4.5 million persons have been fully vaccinated. The total global confirmed cases have surpassed 292 million, while deaths are beyond 5.4 million.
The Lagos State Governor, Babajide Sanwo-Olu, is appealing to residents to get vaccinated to curb the transmission of the fast-spreading Omicron variant. The governor reiterated this appeal in his New Year message during the State House Thanksgiving service. According to the Nigeria Center for Disease Control, Lagos State still accounts for the highest number of cases currently in admission, with over 14,000 positive infections.
I would like to use this opportunity to enjoin everyone in Lagos State to continue to adhere and to comply with the COVID-19 protocols and guidelines so that we can stem this fourth wave permanently out of our system. I want to encourage you to take your vaccine and the booster without delay. And I've seen that indeed with the vaccine, a lot of people are getting well. While on the topic of compliance and adherence, let me also use this opportunity to reaffirm our commitment on the rule of law and its connected impact on our lofty dreams of building a greater Lagos.
Over to Taraba State, where Governor Darius Ishaku says the state's primary healthcare development agency has vaccinated over 100,000 residents against COVID-19 in its drive for total protection and in compliance to the federal government's directive that at least 50 million Nigerians be vaccinated across the country. The governor made this disclosure when he received his COVID-19 booster shot and subsequently flagged off the mass vaccination exercise against the virus in the state.
Taraba State in the northeast part of the country is one of the least infected states, not only in the region but in the country. The state government appears to be working to maintain this as it has now developed a robust vaccination strategy, including the flag-off of a mass vaccination exercise for booster doses and an expansion of vaccination sites from 78 to 318. Having received his first and second jab more than 6 months ago, the state governor, Darius Ishaku, has made himself available again for the booster shot as a way of encouraging vaccine uptake in the state.
Let me assure all of you that the vaccine is safe and found to reduce the transmission of COVID-19 virus and also reduce the severity of the infection due to the disease. I therefore call on you all to accept in good faith the COVID-19 vaccine with a view to reduce the transmission among the population.
The State Commissioner for Health gives a rundown of the vaccines available for booster doses and criteria for eligible persons.
Taraba State has been given additional doses of the vaccine. The Pfizer BioNTech, we have 29,000 doses being given to us. And Moderna, we have 73,600 doses addition. An addition of Oxford AstraZeneca, 160,000 doses. These additional doses will serve as boosters. By boosters, what I mean is that you have completed your 2 jabs, first and second dose. So if you have received your last second dose and it's up to 6 months, you are eligible to collect the booster dose.
Vaccination remains a sustainable solution to manage the 4th wave. However, the Taraba State government is asking the public to continue adhering to public health and social measures which have proven critical to limiting the transmission of COVID-19.
And for more on stemming the 4th wave of the virus, joining us right now, Professor Miriam Aminu, a virologist lecturer at the Ahmadu Bello University, Zaria. She joins us virtually for more. Thank you for joining us on the program.
Thank you for having me.
First, what's your view of the variant of concern, Omicron, and how it's driving hospitalizations across the world?
With the Omicron, we can see that in the last few weeks, hospitalization has increased by almost more than 50% compared to the last few weeks. But the infection is milder and there are no much fatalities with Omicron. It is milder, no much fatality, but it is spreading very, very, very fast. So many people are infected. And as you see in UK now, in Canada, in Japan, in Russia, we've had over 1 million cases in Russia and Japan. But because in Russia, there are only 50% of the population that are vaccinated, we saw only today about 1,000 deaths due to Omicron COVID-19. So the variant is spreading very, very fast compared to other variants, but it is milder and it is less dangerous compared to the Delta strain.
So, Professor Aminu, if we're having that due to the Omicron variant, I mean, here in Nigeria, we're perhaps still seeing less cases compared to other parts, but are we prepared for a further rise in cases? And we're talking about the surge. Do we have capacity to deal with very sick patients?
Well, for Omicron, most cases are not severe. I can tell you that majority of the cases you see today in Nigeria that are saying they have sore throat, they have fever, they have cold, it is Omicron. Majority of individuals have been infected, but it is mild and it is asymptomatic. It's not very, very severe. But in the next few weeks, we cannot say what is going to happen. But I can tell you that Omicron is with us. I can use myself as an example. I have been infected before in November. And then it was very, very severe for me. I could not get out of the bed for 1 week. But in December 17, I started having some sore throat and fever. So I requested for a test. It turned out that it was COVID-19, but the detection rate was very, very low. It's because I was vaccinated. That is why I had less severe infection. I am sure majority of Nigerians have been infected with Omicron virus, but it is less severe and it is mild. So I'm sure we have the capacity to deal with it. It may not lead to serious hospitalization because 4.9% of Nigerians have been vaccinated, even though we have not gotten up to 50%. The case may not be as serious as expected. So Omicron is with us. Many people have been infected, including myself. I'm just recovering from Omicron.
Thank you for talking to us about your experience. But looking at, you said you've been vaccinated. Are we talking about the full vaccination, the complete 2 doses, or the extra booster that, is set to fight against contracting Omicron?
Well, booster is very, very important because the vaccine were produced a long time ago, and they were produced against the variants that were circulating at that time. Now we have Omicron due to continuous spread of the virus because we let down our guard. The virus continued to spread, and then the virus mutated, and we have this Omicron. Any virus Omicron, it has over 50 mutations. Any virus that has been mutated become more infectious and contagious, but it is more resistant to the vaccine. I took my first dose of the vaccine in March 2020, and I took the second dose in June. That's AstraZeneca. I've not taken the booster dose, but I was infected, but it was very, very mild. Why I'm saying this, I want people to know, is that the vaccine, we are not saying the vaccines will not stop infection, but it will reduce the severity and hospitalization. I was not hospitalized. I was going about doing my activities, but it was mild because I was vaccinated. So I'm telling Nigerians that the vaccine will not stop reinfection, but it will stop hospitalization and severity of the infection. That is what we are saying. So people should get vaccinated. I have a data here before me. CDC just released it. Amongst unvaccinated individuals, 451 cases occur per 100,000 cases. Among vaccinated individuals, 134 cases occur in 100,000 cases. When you take the booster, so we are advocating for booster, it's only 48 cases that occur in 100,000 cases. And let's look at the deaths. In unvaccinated individuals, 6.1 deaths occur in 100,000 cases. Those that are vaccinated, is only 0.5 deaths that occur in 100,000 cases. For booster cases, 0.5 deaths. So it will be our call if we want to get vaccinated or not, because it's very, very important that if you are vaccinated, and it will not stop reinfection, it will only stop the severity of the infection and hospitalization. It is important we get the booster dose, and that is what I'm going to get next if I'm fully recovered.
All right. We really wish you all the best, indeed, considering what you've just experienced. But then, the advice there for people to indeed go and get vaccinated. But a lot of people, as you've mentioned, are quite hesitant, saying as, you still might get the virus, but then all the NPIs are very important. I would like to finally ask you one question briefly. Your expectations for 2022 this year, and this is including vaccination targets, our testing, and achieving or getting to herd immunity?
All right. As it is now, as by yesterday, 58.5% of the world have received at least one dose of the vaccine. And 9.2 billion doses have been administered worldwide. Only 8.5 are in low-income countries. That is 8.5%. 99% of countries, such as UAE, have been vaccinated. Italy, about 87%. Russia, only 50%. That is why we are seeing individual, about 1,000 people dying. In Africa, Egypt has vaccinated 32%. Ethiopia, 7.9%. Nigeria, 4.9%. What I'm trying to say is that we have to reach that herd immunity. Herd immunity is when 80% of the population have been vaccinated. That is when we'll break this transmission and we'll control the pandemic. As we speak today, 675 cases, 675,000 deaths has been reported in US. It has surpassed the 1918 flu estimates, which means that the Omicron itself is highly pathogenic. It is spreading very fast. So I can see that COVID-19 pandemic can be defeated in 2022. Yes, it can be defeated. And how is it going to happen? That is when we reach that 80% herd immunity. And this can be achieved when countries work together, when they cooperate together, when we don't let down our guard.
Prof, I just wanted to quickly draw your attention to something that you mentioned, if I may. And that was, you talked about Nigeria's vaccination so far. I think you mentioned about 4.9%.
4.9.
Okay. All right.
Yes,
thank you for that clarification.
Of the population has been vaccinated compared to 99 in UAE. And Egypt is the highest in Africa. That is why you see South Africa is leading when it comes to COVID-19. Perhaps because vaccination is not too strong there, and then because of the weather. And one thing I want to say is about Omicron is highly transmissible, and it has fueled the reinfection by 3%. Remember, I took the AstraZeneca vaccine that didn't contain Omicron. Is a new mutated vaccine, so the vaccine may not be fully this Omicron will be resistant to the vaccine. So what we are saying is that people that are vaccinated, when I was tested, it was very, very faint. It means that I may not be able to spread the virus as much as somebody that is not vaccinated.
Professor.
When we don't spread the virus, the virus will not mutate and replicate. So vaccination is still very, very important. We need to take the booster dose. However, one thing is very, very important. Unequitable distribution, logistics, public skepticism about the COVID-19. We are expected to affect the COVID-19 activities. The most important thing is the fear mongering. People that are
Prof, I wish we had a lot more time, but we need to go now.
Yeah.
We'd like to really appreciate your time. Yeah. Thank you for sharing your experience with us and other issues on the spread of COVID-19. Many thanks.
You should just get vaccinated. Get vaccinated. It's important.
Very true. We're going on a break now. When we come, we have more stories from around the world. Stay with us. Welcome back. Israel's Prime Minister says a fourth dose of COVID-19 vaccine boosts antibodies fivefold a week after the shot is administered. He made the comments at Sheba Medical Center, which is giving second booster shots in a trial among its staff amid a nationwide surge in Omicron variant infections. Israel has played a leading role in studying the effects of COVID-19 vaccines as the fastest country to roll out two-dose inoculations to a wide population a year ago, and one of the first to give third shots as boosters.
A week into the fourth dose, we know at a high degree of certainty that the fourth dose is safe. That's the first piece of news. The second piece of news, we know that a week after the administration of the fourth dose, we see a 5-fold increase in the number of antibodies in the vaccinated person. This most likely means significant increase in the protection against infection and against severe hospitalization and the symptoms.
And Polish Health Minister Adam Nadzielski has told a local media that Poland may decide to introduce new restrictions if cases of new coronavirus infections continue to grow as the country prepares for the spread of the Omicron variant. Poland has been dealing with persistently high daily case numbers in a fourth wave that forced authorities to tighten restrictions in December. Well, family medicine specialist, HOD Family Medicine, Polish Mothers Hospital, Dr. Mikhail Maciasik joins us right now virtually from Krynica. Thank you for joining us this new year. Tell us about the Omicron variant. Hello. Has it been registered in Poland and how much?
Yes, it was registered in Poland late last year, but the number of cases by now are quite small because it's about 80, 90 cases that are confirmed that it's an Omicron virus, but we expect that to grow very fast.
Do you expect that new restrictions will be in place should cases begin to rise? I mean, the Polish health minister said aggravating decisions in terms of the new restrictions will be in place.
The problem is that we actually, the society don't keep to the restrictions that are in place, and they are, I think, not forced enough. Even now, we need new restrictions, and definitely we need to keep the old restrictions in place. But the problem is that the people started to really live normal lives. They tend to forget about the pandemic in a way.
So looking at the number of people who have been fully vaccinated from the over 38 million population, what's your take on the progress of vaccination?
It's a very small progress now. Actually, the only group that really is vaccinated quite fast now are kids between 5 and 11, because we just started those vaccines in the end of December. And we still are quite okay on the third dosage, which is the booster dose. But new first and second dosages are really rare. In our vaccination facility, we have about 200-300 vaccines a day, and maybe 10% of it is new vaccines. Rest is third dosage.
All right, let's get your thoughts on, how Poland has fought the pandemic in 2021 and perhaps some of your hopes for 2022.
I hope that at least some of the people who didn't vaccinate themselves by now will understand that that's the only solution for that virus, and we need to understand that that pandemic is not only a health issue but also a huge problem to the field of the whole population, because we don't have, let's say, money to close the whole country again, and that will be the only solution if we will get the fifth wave at that particular moment. Because last time when the new wave started, the hospitals, the COVID hospitals, were almost empty. Now we have about 20,000 people in those hospitals, and okay, we can put new beds into those hospitals, but we don't have new doctors, new nurses. We have to take them from somewhere else. So basically, number of beds is not the only thing here. So either we will vaccinate ourselves, either we will have a huge disaster.
Thank you so much. Dr. Mikhail Maciasik is a family medicine specialist. Thank you for joining us on the program.
Thank you very much.
The World Health Organization official is reporting that more evidence is emerging that the Omicron coronavirus variant is affecting the upper respiratory tract, causing milder symptoms than previous variants. Here's more on the global COVID-19 update.
Although the World Health Organization says more evidence shows Omicron causes milder symptoms than previous variants, the UN agency believes the variant's high transmissibility means it will become dominant within weeks in many places, posing a threat in countries where a high portion of the population remains unvaccinated.
We are seeing more and more studies pointing out that Omicron is infecting the upper part of the body, unlike other ones, the lung, who has been causing severe pneumonia. It can be a good news, but we really require more studies to prove that. We had a good number of studies coming up, proving again what we heard from South Africa, that the vaccine still protects you against hospitalization and severe disease and death. And that's what vaccines were designed. The challenge has not been the vaccine, but the vaccination and reaching those vulnerable populations.
In other developments, the US has recorded more than 1 million new COVID cases, as officials warn the peak of a fast-spreading Omicron surge is still to come. A record 1,080,211 cases were reported over the past 24 hours, the highest one-day tally of new cases anywhere in the world. The Omicron variant accounts for the majority of cases in the United States. More than 1 million people in a city in central China have been confined to their homes after 3 asymptomatic coronavirus cases were recorded. Yuzhou, a city with a population of around 1.17 million people in Henan province, announced that from Monday night, all citizens are required to stay home to control the spread of the virus. French government officials have vowed to enact by mid-January, as planned, a law to block unvaccinated people from hospitality venues.
Je consulte l'Assemblée sur cette demande.
Despite the legislation hitting a procedural hitch in Parliament overnight. The legislation will remove the option of showing a negative test, effectively barring unvaccinated people from hospitality venues or trains. And finally, authorities in Delhi have ordered people to stay at home over coming weekends, having seen COVID-19 cases quadruple in a week, with its chief minister saying he had caught the virus just a day after he addressed an election rally without a mask. The daily caseload of 37,379 was the highest since early September, and experts expect the highly transmissible Omicron variant has begun to overtake the Delta variant as the latest wave of coronavirus infection builds in places like Delhi, though authorities say hospitalizations have not spiked yet.
ChannelTV.com has the latest, more updates, a better understanding of the pandemic, plus other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.